What causes PANS and PANDAS? PANDAS is caused by an autoimmune reaction to strep bacteria. The idea is that the immune system makes antibodies to fight the infection, but those antibodies mistakenly target parts of the brain, particularly the basal ganglia, leading to sudden neuropsychiatric symptoms. PANS is broader. It can be triggered by many infections such as strep, mycoplasma, influenza, Lyme disease, or even COVID. It can also be related to inflammation, metabolic disruptions, or other immune-driven processes. Sometimes, no clear trigger is ever found. How doctors diagnose it. There's no single laboratory test that confirms PANS or PANDAS. Diagnosis is based on the pattern of symptoms, the sudden onset, and any evidence of a recent trigger, such as a strep infection. Doctors may run tests like throat cultures, strep antibody titers, full blood panels, tests for other infections, immune system evaluations, and neuropsychological assessments. For PANDAS specifically, the diagnosis requires a clear link between symptoms and a recent strep infection, with onset typically between ages 3 and 12. Treatment options. Treating PANS and PANDAS usually requires a multi-layered approach. First, doctors treat any active infections. This may involve antibiotics such as penicillin, amoxicillin, azithromycin, or others depending on the situation. Second, inflammation and immune activity are managed. Medicines like ibuprofen or naproxen can help, and for more severe symptoms, doctors may use steroid bursts. Third, some children need immune-modulating treatments. These are used in moderate to severe cases and can include intravenous immunoglobulin, also called IVIG, or even plasmapheresis, which removes harmful antibodies from the bloodstream. Fourth, children benefit from psychiatric and therapeutic support. Cognitive behavioral therapy and exposure and response prevention can be extremely helpful, especially for OCD symptoms. Medications like SSRIs can also be used, though children with PANS and PANDAS often need very low starting doses. And finally, supportive care plays an important role. This includes sleep support, nutrition, school accommodations, and reducing stress, all of which can influence flare-ups. What the illness looks like over time. PANS and PANDAS often follow an episodic pattern. A child may appear completely normal, then experience a sudden flare, then gradually improve, only to have another flare triggered by an infection, stress, allergens, or hormonal changes like puberty. Many children make significant improvements with proper treatment, some recover fully, others have occasional flares. A smaller percentage deal with more chronic symptoms that require longer-term management. The earlier the condition is recognized and treated, the better the outcome tends to be. Why the conditions are controversial. Although PANS and PANDAS are recognized conditions, they are still considered controversial in parts of the medical community. There is no single definitive test. Symptoms overlap with other psychiatric disorders, and many clinicians are unfamiliar with them. Research is ongoing, and some treatments, especially immune-based ones, can be difficult to access or get covered by insurance. However, major institutions like Stanford, Yale, Harvard, and the National Institutes of Health all have research programs dedicated to these disorders. Who treats PANS and PANDAS? Care is often provided by a combination of pediatricians, neurologists, immunologists, infectious disease specialists, and psychiatrists familiar with these conditions. Collaborative care is typically the most effective approach. Final thoughts. PANS and PANDAS can be incredibly frightening and confusing for families because symptoms appear suddenly and dramatically. But with the right diagnosis and treatment plan, many children experience major improvement, and in many cases, full recovery. If you'd like, I can also create scripts explaining what a flare looks like, how parents can track symptoms, or how treatment works step by step. Thanks for listening.